Hello, everybody. This is Fabienne from the Therapy Center Apex Aquila Swiss at the beautiful lake of Zug. Today, I would like to talk to you about Theratogs and why we love Theratogs. So, our mission is that we provide sustainable therapy management to our kids, and the families. That means when we see our children, we do not just want to have them work while they are in our center. We also want them to continue working at home. So this is where the Theratogs comes into play, because Theratogs means therapy you can wear. So I wonder if you have asked yourself, what is this suit for? What are the strappings for? Most of you guys maybe know the white straps. We often see them in different videos in clinics around the world. So first of all, what the Theratog is doing, the Theratog helps to activate the sensory motor system by improving the body posture of the children. The Theratog was created by Beverly Kuzik. She's well respected, well known, and for me, one of the best pediatric physiotherapists globally. And she is a biomechanics maniac and muscle function maniac. And this is where, this is why she came up with the Theratog. She was also influenced by Shirley Sermon. And Shirley Sermon talks about muscle synergies and how muscles influence each other and how biomechanics play a role. Okay, so basically, what we see when we wear Theratogs can be worn by many different conditions. So it can help to reduce muscle limb spasticity with children in cerebral palsy, or it can also help to increase the muscle tone with children with hypotonia. So while there is quite a bit of research already there that proves that, I still want to go into the foundations, the evidence-based foundations, why it can work. So, but first, let me introduce to you how the Theratog looks like. So we have a hipster, and we have a top. This creates the foundation to attach the different straps, and the straps help to improve the posture. And as I said before, the improvement of the posture activates the sensory motor system. So why is that? Let me explain. So first, not only does the hipster and the top act as mean to attach the tabs, the straps, it also helps to increase the sensory motor representation of the rest of the body. We all have a map of our entire body in our brain. And with children who do not move that well, who cannot roll or cannot activate their limbs sufficiently, there is a disconnect. I think that there is a disconnect between the peripheral body and the central nervous system. So what we do in a way is the Theratog is like me holding the child and increasing the representation of the brain from the body to the brain. The child has a better body awareness, and also it relaxes because it feels snugged. That's why when we wear the Theratog, it should be a snuggy fit, as Beverly Kuzik likes to say. So that's number one. Number two, we have the straps. So the straps has a lot to do with muscle function. So first of all, a muscle that is too short is a weak muscle, and a muscle that is too long is also a weak muscle. So imagine, let's say Maxley. This is Maxley, by the way, famous Maxley. Maxley has a rounded back. So Maxley struggles with head control. Maxley struggles to sit. So if you look at him, can you see that the back muscles who are responsible to lift him up, they're too long. The tummy muscles, they're too short. So even though we practice with Maxley, we hold him upright, often what happens is we bring him upright and he collapses with the pelvis. So he cannot work efficiently. Excuse me, Remco, would you mind bringing me the wedge, please? I just forgot an important detail. So now what we want to do is, yes, thank you. What we want to do is we want to improve the muscle length of the back muscles and the front muscle. Because when there is a so-called sweet spot, when the sarcomeres, so these are the contractile elements of the muscles, when they are nicely overlapping, this is where the muscle can generate the most strength. When with a lengthened muscle, the muscle fiber, the sarcomeres are too far apart, they cannot generate as much energy. It's inefficient. Same as when the muscle fibers overlap too much with a contracted muscle, with a tight muscle, shortened muscle. So with the Theratog, we use the straps. So I have now Maxley in tummy time. So I have him on the tummy, pro. So we attach the cross strap at his clavicle. And then what we do, we help him to get this nice lordosis that he should have. So this natural curvature of his back, you see here? Voila. And this shortens his back muscles. Okay. So we bring the sarcomeres to a point where they can overlap. So now when he's in tummy time, not only from a sensory perspective, he feels what it means to shift weight, the body, the body weight shifts more to the tummy, to the buttock. He also learns that his muscles are shortened, that he can generate more strength. So the tummy time gets more efficient. So, and then in sitting, it would be the same. You can see now that he is nice and upright. Okay, we are helping him to balance out the muscles. So now you also see with some children, especially with children with cerebral palsy, that they have flared hips. So when a child is born, the rib cage is more like a pyramid, and then over the time it should round. Okay, and this rounding of the chest happens because of muscle function. So the oblique muscles are responsible, and the abdominal muscles here, they are responsible to shape the rib cage. Yeah. So, but when a child cannot activate the tummy muscles properly, these muscles cannot shape, model the rib cage. What we have done is, especially often with children with cerebral palsy, a GMFCS level 4 or 5, these kiddos, even though we do a lot of practice with them, tummy practice, they cannot develop the strength because of the position of the rib cage. This is where the Theratogs, they help as well. And I use it a lot in the clinic to prevent such modeling problems. We have the obliquus strap. So this one here, which is attached down at the hips. And then what we do, we go all the way up, down, and nicely up where the oblique starts. And also, we want to give a gentle compression to the tummy. Okay, so here you see that we're shorten the limbs, the tummy muscles as well. Then the next part that we add are the deep core muscles, so the transversus abdominis. Okay, so maybe you know it when you have back pain and you go to the physio, they tell you to activate the deep core muscles. And this is actually not different from what we do here. And how we do that is you take a strap and you put it around. So in a way, you bring the pelvic bones together. Voila. So this is the basic application for Theratogs, and what we should do first with children. Okay. And once we applied this and we helped the trunk muscles to work efficiently, interestingly, what we can see is that the limbs, the upper limbs and the lower limbs, the spasticity decreases. It's very interesting. And by the way, in Beverly Cusick's developmental orthopedics training, she talks about it. Spasticity as well as muscle hyper or hypotonia is still not that well understood. If you like to know more about that, I highly recommend to look into the developmental orthopedics training from Beverly Cusick. It's amazing, and you can learn so much from it. Because let's not go into that deep too much, but that's why as soon as the child has the core strength, what we think is that the child can relax his limbs. Because what do we want? Since we're born, we want to be upright. Okay. And the child wants to be upright as well. So what we see is this, it tensens up his muscles to be upright because he doesn't have the control in the core, right? So giving him that strength can help him a lot to relax his limbs. That's why in clinic, if you have children with an equinus gait, I often see, once I wear the doggy together with the straps, that there is a reduction in tiptoe walking for children with cerebral palsy. So because the tiptoe gait can have several origins. Yeah. So one is if it is a sensory issue with behavioral problems that the child is sensory seeking. The other thing is for children with cerebral palsy, it could be that the child again tries to stabilize, and it stabilizes by walking on his tiptoes. It contracts too much. That's what I often see, especially if the range of motion, so the mobility of the ankle, is good. The other thing that we see is that the center of gravity, so that this is the next point that it's important, is too much to the front. So the child has the tendency to walk on his tiptoes or even to collapse in the midfoot. And that's the other very interesting thing about Theratogs. And that was mind blowing for me as a practitioner, that the center of gravity has such a huge effect on how we move. Let me give you an example. And also on muscle length and function. So the example I had before was the child sitting in that position, right? Around the back, okay? For some time is normal because the baby develops the strength in the back and then come up. But at some point, that shouldn't be the case anymore. So the center of gravity is here, right? But we want the center of gravity to be here, okay? So imagine when the child gets older and we start to walk. In the beginning, it's here, but the older it gets, the center of gravity shifts to the middle. A lot of children, because of them not being able to learn what it means to have, for example, in sitting, the center of gravity on the back, they are not able to do that once they're upright. Okay? So what happens is they are upright, they stand, and then they're somewhere here, and then they walk on their tiptoes very fast. Okay? So what the Theratog does as well is, and it's interesting, when you do the top training, you will really feel how from here, it pulls you back. So it shifts the center of gravity back. What that means is before, when the center of gravity is too much to the front, the back muscles, they're constantly active. They're constantly firing, trying to hold the child up, which then, of course, which are these muscles? You have the gastroc muscles. You have the hamstrings that are active. They keep the child upright as well. So in that crouch gait. Then you have the back extensors and the neck muscles who keep the child upright. So from here, I don't know if you can still see me. So it's here. So the child was here. And then it tries to hold itself upright. And I said before, here the back muscles are too short, the tummy muscles are too long. And what we want to do first is strap the tummy, strap the back to improve that posture here. And then also bring the weight back. And suddenly you see that there is a nice balance between the front and the back muscles. So that's very crucial for the development. okay, and to improve the gait. So that is that. So we talked about the sensory motor activation through improved posture, so a better body awareness. We speak about muscle function, so that by having a better posture with the straps, we are improving the muscle function. You remember the sweet spot. And as a third point, we have center of gravity. That is very important. Okay, so that is very important for the muscle function. So now there is one last point that we need to take into consideration as well when we speak about Theratogs. And this is also from the developmental orthopedics. You guys maybe know that we are moving in different movement planes. Okay, and the development of the child, when a child develops movement, it also goes through that movement planes. So basically, it's first in a sagittal plane. So that means like this, because the child starts to lift up his head first. Yeah. Then once this is mastered, it moves to the frontal plane. So for example, when you see a baby starting to shift from one side to the other, yeah. Then a third one is the transverse plane. So the child rotates his trunk. And so the sagittal plane is based on the frontal plane, and the transverse plane is based on the sagittal plane and the frontal plane. So what that means, I often see children, they come to the clinic and they're maybe 4 years old, and I still see them walking like this. Yeah. So when you have a child who still walks like this is how a new walker would walk. So stiffened up and moves almost in a frontal plane. Okay. So what these children are often lacking is the sagittal plane. So maybe they have not developed the strength in the front and the back. Yeah. Sorry, in the sagittal plane. And when they don't have this, they cannot develop a proper frontal plane. And as a consequence, they cannot develop a proper transverse plane, which they need for a mature gait. Yeah, that rotation. So that's why sometimes with these kiddos, we need to go a step back. So before we start to, this is what Beverly often says, Billy, before we start strapping the limbs and the legs to help with like, I often see children with a scissoring gait. So this is a scissoring gait. I often see them having just the limbs, just the legs strapped out or in, which we can do as well with the Theratog system. So in towing, out towing, we need to measure first and evaluate if it's appropriate for the child or not, if it's safe or not. That's very important. So you can do that too with the Theratogs system. But in the end, what we need to focus on first, and this is why I talked about that developmental stages, yeah, from the planes, and we have flexion, extension as well. So we need to go through these stages first to fully mature, okay? And this is where the Theratogs can help as well by supporting that extension here, yeah? Because if you don't have a proper extension of the back, the tummy muscles cannot work, okay? So in one of the trainings, Beverly shows this example. I don't know if you can see that you have when you're sitting with a rounded back and I push you back, it's very likely that your tummy muscles, they will not react properly. If you have a nice extension and you go back, you feel that your tummy muscles, they fire immediately. And this is where we come back to that muscle imbalances muscle function. So posture improves sensory motor function. Voilà. So that's a lot of talk, I know, but it's an incredible tool, and I'm not just using the Theratogs for children. I use it also in adult neurological treatment, but even if you have patients with shoulder issues, because the shoulder is a joint that relies heavily on muscle function. And a lot of the problems we see with shoulder patients is that they do not have the sensory motor capacity to move their shoulder properly. So what I did a lot as well in my time when I was doing a little vacation from pediatrics and worked in sports, that I improved the posture of the shoulder and the back. to improve, as I said before, the sensory motor function. Voila. So that is that. Now, let's go to frequent questions for Theratogs. So, by the way, if you have any questions regarding Theratogs, feel free to reach out to us. You can reach out to us via WhatsApp or by subscribing to our channel, and then you can leave a comment below the video, okay, or on Instagram. It would be amazing if you could subscribe to our channel and if you could like the content that we do here, because I do believe that more and more parents should understand what Theratogs are and how they can and why they help. Oh, this is Nemo. Hi, Nemo. This is our little Nemo. He is one of our therapy assistants, and he loves to be on camera, so that's why he decided to swim through the camera. Yes, beautiful, beautiful. Yes, I often use the fishies to talk about reflex integration for the ATNR, right? So it's a little bit like a fish. Okay, so going back to that, frequent questions. What makes the Theratog so special, or why should my child get a Theratog and when? Your child should ideally get a Theratog if you see that he has delays in his motor skills, even fine motor skills, because what I observe as well often is that kiddos, when they do occupational therapy, and me, since I did the training with Beverly and I used to be a ballet dancer, I am pretty much into posture. And I see kiddos sitting like this, doing the exercises from the occupational therapist. I used to work in an interdisciplinary setting. Hi, everybody at Olivia's Place. So, and what we need to do there is first, as I said before, we need the trunk that is strong. We need a good shoulder function. And we can achieve that by, you know that now, by improving the posture to activate the sensory motor system. So, quick example, if you have a child who has a rounded back and cannot write properly, you could use a wedge. Yeah, have the child sitting on a wedge on the chair, that his pelvis moves to the front, and by the pelvis movement to the front, it shortens the back muscles. Okay, there is also a lumbar extension strap from Theratogs. So if you have any questions how to apply that, you just let me know. Okay, but when you have a child for fine motor, start with the trunk. But the problem is, especially if you start trunk training, this is what I try to explain to my parents as well often. If you start trunk training, it takes 3 to 4 months of high intensive strengthening. Yeah, not just body work exercises, that these muscles can catch up. Especially if, in addition, the child is has muscle hypotonia, it's going to be even more difficult to get these muscles up, right? So, but they still need to learn how to use tools and how to write, okay? So this is where the Theratog can close that gap, okay? That ends, for example, with a sitting wedge, that the child has a better trunk muscle function, a better shoulder function. Yeah, so let me just quickly, I could actually show you that quickly. So basically, there's also a shoulder strap, yeah, that brings the shoulder girdle to the back, and then as a consequence, the scapula thoracic and the glenohumeral joints, so the arm and the shoulder joint on the chest, can work better. And when this works better, the child can write easier because the hand relaxes, as I told you before with the CP2. So let me just show you this quickly. By the way, it's very important. The Theratog itself can be, so you really need to learn how to wear a Theratog, okay? And also the practitioner, the physio or the orthotic specialist who does the evaluation of the child for the Theratog should be well trained, and because otherwise it could be that you get a Theratog and then maybe you will not get the same effect out of it. So if you really need to have a practitioner showing you how to do it And then usually for the first 2 weeks, you just apply the suit. And then in the next 2 weeks, you learn how to do the strapping. But again, in general, from my experience, most of the children do only need, especially when they're below 4 years, they mainly need the trunk piece, so the postural torso alignment system. Yeah, and it's easy to wear. And my kiddos here, again, as it's a management, especially the CP kiddos or the hypotone kiddos, who also have body awareness issues often, they wear it every day. And just like Maxley, they wear the Theratog and then they put the diapers on top of it. Because in the end, it's a little bit like a brace, right? You put in the brace and then you have it there for some time that the teeth can grow properly. And it's the same for in that sense, for the body and the brain, for the whole system. We want a change of system, right? And not just a temporary fix, which sometimes with rigid braces, that could be the case. Important to say, when it comes to scoliosis, the Theratog can help, but only when I can fix it with my hands. Yeah. If I cannot fix the position with my hands, the Theratog is not the appropriate tool for the kiddo. Very important. Same for rotation straps. Okay. Important. I wanted to show you so I hope I did not overload you with all this information. I know it can be a lot, but yeah, I'm very passionate about it. So you see, so this would be a shoulder strap that I told you before that you could use to improve for the hand. There's also a hand system if you have a child with hemiplegia, for example. And the strap for the back, for the upright sitting, looks something like that. Yeah. So it's here. By the way, you can find more information on our website, Apex Aquila Swiss, where we explain everything about Theratogs in English and in German. So that is that. Do I have anything else I want to share? Yeah, So I talked about this. So now, back to the frequent questions. Often, so parents say, "Oh, it's too difficult to learn how to put it on," and that's not the case. It's really straightforward. So once you know how to apply it, it takes you a few minutes. It's really not a big deal, because in the end, what it is, it's this and this, and then 3 or 4 straps. Okay, simple. Now, this was a lot about conditions for cerebral palsy and so on. Now, let's just quickly talk about conditions of the lower limbs, of the legs. For example, when you have children that out toe, so when they walk, their foot thigh angle is out here, like a little duck, or to the inside. Let's talk about this quickly. This is where we can help as well. But even in these conditions, you should always start first evaluating the posture of the trunk and the muscle function. We do that with an angle finder. So, for example, when we want to know if maybe we need to work on the pelvic position, maybe it's too much to the front or to the back, we use the angle finder to see if and how many degrees we need to improve the position of the pelvis in the sagittal plane. And once this is done, we check the hip the hip. We check the head of the femur head. In English, it's a bit. Oh wait. We H&A the head and neck angle of the femur. Okay, so we check that, and we also check the femoral torsion, and we look at how many degrees the hip is antiverted or retroverted. And once we find out if it's safe to apply a strap for the kiddo, we could apply. Let's say that the child is walking that it intones, even if it's cerebral palsy. But again, you need to start with the trunk first. Very important. You need to improve the center of gravity and bring it to the right position, improve the muscle function of the trunk. Once you see that it's still not better, that's the moment where you go, okay, let's go for the feet. Let's go for the legs as well. And then, for example, in the case of in-towing, you could apply an external rotation strap. So I would have to put this high up. So here on the thigh, like this. Then you, in standing, of course, you would apply it here. It's a bit too short. So, and then you can go all the way around. Yeah, so that would be this. Okay, and then if you have a child who autos, it will be the other way around. Okay, but sometimes the child is too old. You can only do these rotation straps up to the age of 7, because after the age of 7, the maturation of the bones is set, especially of the hips. So we don't want to do that after that. But then we can still help the kiddos with stabilizing over the sides of the limbs. Yeah, so the hips, because when a kiddo toes in or collapses when it walks to the inside, one of the reasons as well it could be is that the decelerating muscles of the hip. So if the child stands on that leg and brings that to the front, so the muscles who stop the hip from falling down, from sinking down, they cannot stop that movement. Yeah, so they cannot decelerate. And one of the muscles who does that is the gluteus medius, right? And the tensor fascia latae, and then of course we have the IT band that also plays its role. And in that case, let's say if we see that the rotation strap doesn't do much, yeah, or you have a child that collapses to the side, we can do where is it? We can do. I can take this one. We can do the IT band strap. So you touch it here and here. And then basically, so the IT band is around here. The IT band goes over the hip joint, here to the side, over the greater trochanter. So we go down and then all the way down. So this is the other. Okay. Oh, there's someone else coming. I should see someone swimming in. Okay. So you see there are many. Oh, yeah. This is our manta ray. He is also, he really loves to be on camera as well. But anyway, you see, there are many, many ways you can work with a Theratog. It's an amazing tool. And yeah, I think let's go to the take-home messages for today, because we're already at the end of today's live from Apex Aquila Swiss at the beautiful lake of Zug. So first of all, what's the goal of Theratogs? The goal of Theratogs is that we improve the posture of the child or the adult to improve muscle function and sensory function. Okay, so that's number one. Number two is when we have a strong core, so when the muscles are the joints are properly aligned, our muscles can work better, and this often leads to a reduction in spasticity or hypertonicity of the limbs. Okay. Third message, if this still doesn't help, we also want to address how the child sits. So maybe we need to get a wedge and have the child sitting on the wedge upright, that the pelvis is moving to the front. And also maybe we need to work with AFOs, ankle foot orthoses, to give what, I don't know the name of the physio, but Billy calls it the stiff ankle, that the child has stability down from the foot. Okay, so these are the three things. Just to let you know, we also, so ideally we do the Therapy fittings on site. Yeah, because we work family centered, so we see the parents here. I look at the child, I do a physical therapeutic assessment, we do the checks with angle finder and so on, and then we evaluate which system is the best and how to strap. And then once that is done on site, we will see the parents again for a fitting. We will see the parents again to check how they apply the toggies. Okay, so that is that. Just to make sure that the parents are really comfortable to have the toggies, to have the child wear the toggies. The toggies is a management. Yeah, it's not, I mean, you can, but in our clinic, in my practice, I want the child to wear it every day to have sustainable, long-lasting changes, not just from the periphery, but also from central. Okay? Yeah, so if you cannot if you would like to have a chat with me anyway, you can now click on somewhere. I don't know if we have a button somewhere, but you can go online and on our website or on Instagram or YouTube or whatever, TikTok, and you can book in a free online consultation with me for around 20 minutes. If we see that maybe I can give you some advice, we could then start with an online fitting in Theratogs, or ideally I could see you here in the clinic. And yeah, once that is done, I would send you the Theratogs to your place and we would go through the fitting process together. Okay, fantastic. Yeah, and I think that is that. One last thing, yes, we also, I work with the Theratogs in each intensive. The child has to wear it, yeah, on the skin with the straps, because I remember I told you about the muscle function and the body awareness. I want the child to have as much sensory motor activation as possible. And I want the child to generate as much strength as possible while it's doing these exercises. That's why in each of my sessions, in each of my DMI level C sessions, I am using the Theratog, and each child has his own Theratog because I think it's an amazing tool, and in the long term, it makes a huge difference. Okay, guys, that is that. It was such a pleasure to talk to you. And if you have any questions, feel free to reach out. Maxley and me, we say goodbye for today and see you soon. Bye.